My name is Josiah Wink. I'm a political science undergraduate major at Shepherd University, interning with the Stubblefield Institute. Today, I'm here with Erin Delullo, a consultant at Harbor Path, which is a nonprofit organization that works to meet the unmet medical needs of members within the community. The Stubblefield Institute works to promote civil political communication within the community through grassroots involvement and the awareness of current local and national issues. So we are here today to have this discussion to talk about perceptions surrounding the opioid epidemic and funds allocation ahead of our community engagement conversation panel. Our community engagement conversation panel is How is West Virginia Putting West Virginia First? And that will be on November 14th at 5:30 p.m. I will be getting into that a little bit later. All right, so how are you, Erin?
I'm great. Thanks for having me, Josiah.
Of course. I'm so happy you're here. So one of the questions I have for you is, almost everyone knows someone who is affected by the opioid epidemic or has been affected themselves. This is a common theme that we notice. How have you found yourself able to do the work that you do to better impact the lives of those who have been affected?
Oh, thank you for asking. So I am a Shepherd College grad, as you mentioned, and I was raised here. I went through the public school system in Jefferson County, West Virginia, then went off to Washington, D.C. for my career, and my family came back in COVID. And that is where I really saw the effects of this epidemic. And I decided I needed to get involved and was able to connect with Harbor Path, which they do great work in providing a whole variety of prescription medications to people who may not be able to afford them or have access to them. So we, in the last 18 months of working with them, we've distributed naloxone, or as commonly known, Narcan, to high schools, colleges, different medical facilities that just weren't having the supplies they needed. And there were just so many stories I was learning along the way, and facts that I wasn't being exposed to otherwise. So I started the Poisoning podcast really in my own time. And maybe I sleep 2 less hours a week, but it's worth getting the knowledge out there.
Yeah, that's amazing. I've been able to watch a few of them, and it's been really informative for me.
Thanks. By the way, people don't know they're being poisoned.
No, a lot of people don't know that.
They think they're taking a pill that might be someone else's prescription. The cartels, the drug dealers, are making these pills to look real. They are conning people.
I've noticed that a lot of, and the research I did when I took a class on the opioid epidemic and a lot of the individual research I've done, I've noticed that a lot of people don't realize what they're taking in because things may be cut with a cheaper drug such as fentanyl or xylazine. So like you said, a lot of people don't realize, and I think that's one of the really important factors of having naloxone readily available, because someone could be at a college party, they could be taking something that they think is a lot lesser, and then it turns into a very drastic medical issue.
It does. And now if you're prescribed like over-the-counter pharmaceutical opioids, you are given a prescription for naloxone. Now, it's your choice to fill it. And I've been talking with a state rep in Alabama. He's also a pharmacist, and he will tell me that people won't take the naloxone. Like, he has to counsel them and tell them how important it is. What if a young child gets into those pills? What if someone, anyone else gets in the pills? Don't you want to give them a second chance?
I think it's also important with elderly individuals who may not have realized they already took their medication, and then they may take it again, which could result in an overdose. I think that's another reason why naloxone is important that may be possibly overlooked in some cases.
Oh, I think there definitely was a stigma. We've encountered sheriffs that say, well, we're not in healthcare. We don't want to carry Narcan. But to me, Narcan is no different than a resuscitation mask. So I feel that it's getting better, but we can't let up. We keep have to educating people and showing. And my latest episode with Dr. Martin, who's one of the addiction medical specialists in the state of Arkansas, I mean, she has patients now that she'd saved in the emergency room that live totally normal lives. because they had that chance.
I think that's really important that we have that readily available because of that. So another question I had is that some experts believe that strategic spending should be considered when dealing with the opioid epidemic. These expenditures come with the cost of what they're used for, but also what may not be being addressed. In your opinion, what do you believe is the best combination for allocation of resource funds?
Like a formula?
Yes.
I'm not a mathematician. Sorry. I don't have a perfect formula. I think every state is different in what they're experiencing. For instance, here in West Virginia, we have had nearly 1 in 8 babies born with neonatal abstinence syndrome, which means they were born addicted.
I've read about that.
And have to go through withdrawal. We sadly have one of the higher rates in the country. So we might want to put money into a maternal program and educating and trying to get these pregnant mothers into sobriety, because what their babies will then go through, which is you need a longer hospital stay, which costs everyone more.
In your experience when you've been dealing with these funds, what has worked best for you in your work and what you've been able to do?
I think having real stories, like I'm not a drug user. I am really careful. Even like going places, I tell my children, don't take candy from a person. Like if you think they're your friend but you haven't seen a wrapper or it's not sealed, don't touch it. I sort of now being exposed to so much, I'm quite paranoid about things. But I think having survivors tell their story, I think having doctors tell their stories and what is working for them and their communities is very key. I think we have some great people on the foundation, but you know, we all need to hear what happens firsthand and what will be needed.
I'm curious because you have a lot of experience working in this avenue. What might your advice be to someone like a mother who wants to do more in her community, or a grandmother who wants to advocate more for her children, or just someone in college who wants to get more involved? What could you recommend that they might do?
One, go get naloxone. I know in this area, at the Berkeley County Day Center, Tim has it in paper boxes. Anybody can walk up and just take it out, carry it on you. Advocate for trainings at your school, at your place of worship, at your work, and make it constant. Until we're at 0, it's not good. I mean, this is the biggest killer, and it never hit me until I started doing this podcast. This is the biggest killer of our military-age men. I mean, that is what China is doing to us right now. And I don't think people realize it.
I think from what I've noticed is that a lot of military, young military men or people that are coming back, they may be more susceptible to PTSD or anything like that.
Totally, mental health.
Yeah. So.
And you know, I'm going to interrupt you. The great Dale King in Portsmouth, Ohio, another sort of, I call brother or state of West Virginia, he is working, and I hope he gets his grant from the state of Ohio because they've applied for one. He is working with a treatment program where they do CrossFit with the people with addiction issues. And it's showing great numbers. We have to think a little bit outside the box. We're always thinking so corporately. And what he's done in saving lives in his part of Appalachia is amazing. And maybe we can try that here.
Possibly. I agree with you. So wrapping things up a little bit,
Sure.
Is there anything else that you would like to share for the audience at home?
Well, I would say always carry naloxone. You can reach out to me. It's easy to email me, Erin at my last name, Delullo.com. Happy to always connect people, but people deserve second chances. It's so easy to carry and administer naloxone.
Really
so please
is.
do it.
All right, so I wanted to thank all of our listeners for coming in. I wanted to thank Erin Delullo for coming out
Sure.
and giving your time to us to discuss this issue. So I want to invite all of our listeners to join us on November 14th at 5:30 p.m. at the Bird Health Science Center at Berkeley Medical Center in Martinsburg. This will be for our community engagement conversation titled, How is West Virginia putting West Virginia first? We'll be joined that evening by the leadership of the West Virginia First Foundation, including Matt Harvey, Jonathan Board, Tim Czaja, Stephen Skinner, who was the attorney who litigated the settlement, Stephen Travis, and Dr. Stephen Lloyd. I want to note this event is free and open to the public. More information can be found at StubblefieldInstitute.org or by calling 304-876-5005.
Thank you.
Of course. I'm so glad you were able to come.
Oh, you're welcome.